Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show I bring you key experts in the fields of nutrition, prevention, integrative, lifestyle, functional, alternative medicine, and also we bring key researchers that have done things and written articles and review them with you. Sometimes I'll do an interview, and today I'm going to talk about what's in my current Substack. There was a particular very interesting topic, and then I have my usual other panorama of topics. So if you want to, you can watch the video and then click on the link below if the information isn't below, and it will take you to the Substack and you can have access to all the links and the summaries. So here we go. This is about Galectin-3. So the title is Galectin-3 is good for neuroinflammation, heart disease, cancer, and other chronic diseases. And now, why this came to my uh, interest is I kind of had Galectin-3 in my radar listening to Dr. Peter McCullough talk about how to assess myocarditis and heart inflammation in um, with regards to COVID-19 or the vaccine. And galectin-3 is a protein that is released in the body, and usually it's a way to follow heart failure. When there's a lot of galectin-3, it can lead to fibrosis. It's a marker of fibrosis. So that's where I've heard about it before, was in heart failure, and people follow it there or heart damage. But little did I know, I go to the anti-aging, A4M anti-aging meeting every year in Las Vegas in December, and there was two speakers there who reviewed uh, galectin galectin-3 as a marker, not just for heart disease. It was actually not the focus. It was for neurodegeneration. It was fascinating, and I learned a lot about galectin-3, and I'll be using that as a measurement much more. So the speakers that were there were James Laval. He's a registered pharmacist and a very well-known nutrition speaker uh, on the anti-aging circuit, and also was a neurologist, Dr. Sheldon Jordan. And so they gave this intense talk over a half hour, and I'll try and summarize some of the highlights for you. But again, it'll be written in below. But their talk was focused on neurodegeneration and how galectin-3 is a significant marker and reason why there is neurodegeneration, but also there's a monoclonal antibody that has been created, an anti-galectin-3 antibody that may be actually a very remarkable treatment. But I wanted to give this context to you as a measurement. It's kind of like I think galectin-3 will be for me as like a fancy C-reactive protein. C-reactive protein is a marker that we use for heart disease. We like it below 1, but many times it's elevated in many conditions. So if you have an infection, a urinary tract infection, boom, it'll be sky high. If you have a chronic cancer and people can't find out what it is in a very high level, let's say above 10 or so, it can be a cancer. So C-reactive protein is a general marker we think of as heart disease, but sometimes it's non-specific. Well, galectin-3 happens to be, I think, even better because it goes up with cancers, it goes up with neurologic conditions, it goes up with heart disease conditions. It goes up with almost every chronic disease, and I didn't really realize that. So I'll give you a little summary, even though I put a pretty in-depth summary in this Substack. But galectin-3 is actually a driver of inflammation in the body, and it leads to the neurodegeneration, metabolic dysfunction, and it can be seen high in like Parkinson's disease and Alzheimer's disease, and that's where this talk came from, but also diabetes, heart failure, and other fibrotic conditions if you have liver fibrosis or something like that. So what I think is key here is, what can we do to actually measure it? And you can, it's very simple to measure. And I put in little values here, but ideally we'd like to be below the low range of 17.8, but it's something you can follow, like very high and rapid progression heart failure is above 25, let's say. And it correlates with things that we do very frequently in the office. We do C-reactive proteins, we do hemoglobin A1C, the average blood sugar over the last 3 or 4 months. It's because the sugar attaches to the red blood cell and it lives that long. So we use that as a marker, and fasting glucose. And so it correlates with some of the markers we normally do. So if you have elevated galectin-3, you're going to have more potential neuroinflammation. You're going to have more insulin resistance, which is related to almost every chronic disease condition. And probably when you have environmental toxicants, this is why it goes up in things like Parkinson's disease. So it can pick up subtleties. So how do we lower it? I'll give you some little pearls here on how to lower it. There's some natural compounds that lower it. So modified citrus pectin, use it all the time for cancers now in particular. Green tea catagens, again, a lot for immune augmentation, used a lot in cancer, but this will help lower galectin-3. Curcumin, turmeric. Turmeric does everything anti-inflammatory, but it helps lower galectin-3. Resveratrol helps lower it. Quercetin, we use that a lot in treating COVID, and I used it a lot prior to COVID in allergies because it helps. Berberine and omega-3 fatty acids. So those are some of the simple nutrients that can lower galectin-3. And if you're lowering galectin-3, what you're doing is you're lowering your risk to neuroinflammation, diabetes type things, cardiovascular disease, um, almost every chronic condition. So if you see it go down, that's a good sign, and that means you're doing something right. Nutritional factors, same thing as a lot of chronic diseases. We're going to put people on a low glycemic diet, whether you're on a more of a paleo type diet or a plant based diet. The key is to eat no processed foods, no processed carbohydrates. And I like to keep my patients' insulin levels around 5 or below, and A1C is about 5 or below. So that's a goal there. And so we see that go down when galectin goes down. Anti-inflammatory diets help lower that. Mediterranean type diet, whole food diet, lots of polyphenols, and then prebiotics. High fiber foods um, are good for lowering galectin-3. And this is very, very important because there's things called lipopolysaccharides that when they get elevated can cause inflammation. And so galectin-3 helps lower those, and a high fiber diet helps with that. Fermented foods, we all know that. So sleep can be affected by and can help reduce galectin-3. So the reason I brought it up is just it's a marker. I think it's a really cool marker because I can follow a lot of diseases, or you can pick up things. So if you do a routine, people come in with 5 or 10 conditions they're concerned about, and you see that galectin-3 elevated, it's a marker to see if we're making progress, like the C-reactive protein is in a way. Okay, like my favorite ones are hemoglobin A1C. Fasting insulin is my favorite. I can almost that and an inflammatory marker such as C-reactive protein or galectin-3. If those are coming down, I know we're going in the right direction. So that's galectin-3. There's a lot more in there about it, but I think it's something that you could ask your doctor for, or as a clinician, I think it's a valuable tool to follow people. Uh, Now the next is uh, vitamin C. So there was a great article done from China on vitamin C, and I have a link there. High dose vitamin C, a promising anti-tumor agent, insight from mechanisms, clinical research, and challenges. So it's a big long article, but basically it talked about the early years where vitamin C started to get some traction with the Linus Pauling and Ewan Cameron way back. I want to say the 60s. I remember reading their paper, and then Charles Martel and the Mayo Clinic came out with a study that negated some of that. So vitamin C got thrown out as an anti-cancer or a cancer supportive therapy for many, many, many years. And so there's been more studies on high doses of intravenous vitamin C, which acts as a pro-oxidant. The belief is it gets converted to hydrogen peroxide, and that has literally a cytotoxic oxidative stress reaction to the cancer cell. But this article talks about kind of not letting vitamin C slip away. There's been more data about higher doses of vitamin C intravenously, 50, 75, 100 grams, and giving several times a week, along with chemo therapy, immune therapy, and possibly radiation therapy. And so these researchers were going over this very sophisticated biochemistry of it, but they were trying to encourage that we need not throw the baby out with the bathwater, not lose momentum as people are being more open because they can see the physiology of high dose vitamin C in conjunction with traditional approaches. in my view, I'd use it in alternative approaches. So they're wanting to keep this alive and study it, but the doses are pretty high. I mean, 50 to 100 grams, 3, 4 times a week. So I was very fortunate. I work in an integrated medicine practice, and during my colon cancer, um, I would be sitting in here with my IV pole to the left of me, and I would have IV vitamin C going in from 25 to 50 grams. And probably the reason I did lower is because it's time consuming, to be truthful. But I was very fortunate because I work in a place that we do it, that I could do it 3 to 5 times a week. I probably did it for a year like that, and then I cut it down. So I'm a big fan of vitamin C, but it's getting some momentum, and hopefully it'll be studied more. So we have some biolabs, as you well know, that had some toxic products. In Las Vegas, it was discovered, and it's a great concern for our national security and actually the world's security. Uh, Blood sugar, there's an article on blood sugar related to it called Disentangling the Relationship Between Blood Glucose, Insulin, and Brain Health. So, blood sugar comes up in the brain all the time. Alzheimer's is sometimes described as type 3 diabetes. And then there's a great article by Dr. Jeffrey Dash, and I put all the reference articles there so you can click on the link and it goes right to the article. But it's about using creatine and a phosphatidylcholine compound and combination to help with cognitive issues in the elderly. And so it seemed it was a great article. He's very good writer, does very good work. And then I'm always interested in sharing with people that your brain is called the glymphatic system. It's cleansing every night. So my weak areas, I don't sleep a lot. That's where your body does a lot of work on the brain. Very important. But it's called the lymphatic system. So a way of cleansing the brain of toxins. There was an article on 8 nutrients that a gastroenterologist would recommend for the gut, and I'll just list them all for you. But it's prebiotics, which is actually the fiber. Okay, that's what the bacteria chomp on. Probiotics are actually the bugs that are created by eating the fiber. They change at the fiber that they eat. So that's 2. And then was curcumin, magnesium, melatonin, omega-3s, vitamin D, and zinc as important for the gut. And I can think of, curcumins, anti-inflammatory. Magnesium, it's kind of a muscle relaxant, smooth muscle relaxant. Melatonin is a potent antioxidant. Omega-3 fatty acids are anti-inflammatory. Vitamin D is a hormone that is everything almost. It's anti-inflammatory. It has immune augmenting effect, and zinc helps rebuild tissue. Then there was this article on heart disease and love, and their belief, and they go into some research there. I have 9 or 10 articles on how good thoughts can actually change your heart function and structure. And then there was a couple of articles on marriage and social and longevity. And one was marriage helps people live longer, especially the men. So that's an interesting thing. And then longevity, socialization, and a thing that I've studied a fair amount when I studied the Okinawan centenarians. I actually went to Okinawa and interviewed way back when in 2016. I interviewed the Wilcox brothers, and it's still on YouTube, about the longest centenarian study in the world. And anyway, in one of the lifestyle factors in the Okinawans, aside from diet and exercise, etc., it's socialization. And they have, especially for the females, they had a thing called, and they still do, called a moai. And it was that traditionally females in a village would get together and they would meet once a week and forever. And I'll never forget this picture of these nonagenarians sitting there with a camera coming down, and they're all sitting cross-legged on the floor, and they're all silver white haired. And this was a Moai, a group that had been coming together every week for a year. So think, if you don't show up, your friends come and find you. So there was a very much incentive. And they also had some in the olden days help financially with each other, and the community would help. But socialization, critically important for aging. Then the cancer, I always review some cancer work by Dr. William Mackison. again, a trend that I see is that aside from ivermectin and either fenbendazole or mebendazole, there's a combination. Sometimes he's using both now, fenben and mebendazole, along with the ivermectin, and there's nutraceuticals that go along with that. And then and two other things that seem to be sneaking a little bit more are modified citrus pectin, which is an old cancer therapy. It's been around for a long time, and then CBD. And then one really important thing that hopefully will pass is that Senator Rand Paul introduced Senate Bill 3853, and that's to end vaccines manufacturers' liability shield. And I believe that was in 1986 or 1989 that President Reagan put that into effect, that the manufacturers for vaccines weren't held liable by the individual. And if that changed, that would be fantastic, because then it would be like every other product. It's pharmaceutical manufacturers are the only business that are exempt from, they could be sued by the person that uses it. And so if that went away, then I think we'd have safer vaccines. Let's put it that way. Um, okay, well, that's about half the information that's in this, not even half, that's in this Substack. So read it below if you want, or get connected to it. And my name is Kirk Hamilton, and I'll talk to you soon, and you have a wonderful day.